Delegation overview. Delegation is the act of transferring responsibility and accountability to another person to carry out a task while maintaining accountability for the action and the outcome. RNs must delegate numerous tasks, and delegation is a core nursing responsibility. Nurses most frequently delegate tasks to LPNs, licensed practical nurses, and to unlicensed assistive personnel, UAP. In deciding when and what to delegate, RNs must take a number of factors into account, including the scope of practice required for the task, the complexity and predictability of the task, the potential for harm, and level of critical thinking required to perform the task. Delegation is important for both practical and academic reasons. It is a core real-world nursing skill, and it is also a major focus of the NCLEX-RN exam.
First, we talk about RN's practice scope. So this is the pie we have been talking about. Independently assess, monitor, and revise the nursing plan of the care for patients any kind. Initiate, administer, and titrate both routine and complex medications. Perform education with patient about the plan of care. Admit, discharge, and refer the patient to other providers. Delegate appropriate tasks to both LPN and UAPs. The tasks that RN may perform include the ability to initiate and administer blood to a patient, administer high-risk medications, include heparin and chemotherapy agents, give IV medications and medications administered via IV push, independently monitor and titrate medications, perform any tasks that may be performed by LPN or UAPs. For licensed practical nurses, the scope of practice are assist the RN by performing routine tasks with predictable outcomes, assist the RN with collecting data and monitoring client findings, reinforce an RN's patient teaching but not perform independent patient education or assessments, perform any of the tasks that unlicensed assistive personnel are permitted to perform, delegate tasks to unlicensed assistive personnel. Tasks that an LPN may perform include the ability to administer medication that are not high risk. For example, LPN may administer standard oral medications, but not medications such as heparin or chemotherapy agents. Some states do not permit LPN to administer intravenous medication of any kind. Administer NG tube feeding, check NG tube patency, perform wound dressing change, monitor blood products. LPN may not initiate the infusion of the blood product. Only an RN may initiate the infusion. Do tracheostomy care, perform suctioning, administer enteral feedings, insert a urinary catheter. For licensed practical nurses with further education and certification, LPN may administer to maintain IV fluids, IV medication via piggy bag, monitor infusion of the IV fluids. It's not within an LPN scope of practice to administer high-risk medications of any kind, such as we mentioned, only RN can do heparin and chemotherapy medications. Administer IV push medication of any kind, titrate medication of any kind, independently provide patient education, such as medication disease process, etc. Perform or chart admission of patient or to discharge patients. For unlicensed assistive personnel, the scope of practice are assist the patient with activities of daily living, including eating, bathing, toileting, ambulating, perform routine procedures that do not require clinical assessment or critical thinking, such as phlebotomy, except for arterial punctures. Take vital signs, monitor intake and output of food and drink, urine, etc. Pay attention. It is not within a UAP scope of practice to perform assessment, delegate tasks, perform patient education, perform tasks that require clinical expertise, including routine tasks such as administering medications, administering tube feedings, performing wound care of dressing changes. The practices are limited. To summarize with comparison here, things are not to delegate are activities that includes nursing process, activities that require specialized knowledge, judgment, and skills. Initial nursing assessment, determining of nursing diagnosis, is establishment of goals, development of nursing care plan. The role of LPN are assist with implementation of care, perform procedures, recognize abnormality with guidance, cares for stable patients with predictable conditions, has knowledge of sepsis, administer medications like POM, not IV most of the time. The role of UAP are direct patient care for stable patients. Scope of practice is limited. Activities including bathing, vital signs, feeding, transferring, ambulating, height and weight, I&O, housekeeping, stocking supplies, etc.